introductory break, we move on to the presidential address by the ESI president. And I welcome Dr. Kirti Samudra to moderate the session. So Dr. Kirti is practicing, she's a very good friend and a good supporter of Synapse right from the start. She's a practicing physician diabetologist at the Diabetes Care Clinic, New Panvel. Total 30 years of practicing experience, more than 25,000 registered patients, and she runs a lot of patient education programs. She's been faculty for the PHFI and a speaker, well-known speaker in the national and regional conferences. So over to you, Kirti.
Thank you, Vaishali. I take this opportunity to congratulate Vaishali and Chetan and Dr. Phadke for this nice concept. Dr. Indranil was talking about that somebody should get a Nobel Prize from the audience. Before that, I propose that maybe Vaishali should be nominated for Padma Shri at least to take taking this at national and even global level. So we should recommend her name for the next year Padma Shri. And the topic for today now, which we are going to hear from the president of ESI, is basically on yoga. Yoga, we are listening how it is important, and my previous moderator, Dr. Jayashree, was saying it's dil mange more. I should say it's man mange more, because we are into mind-body medicine. And like Dr. Indranil was also saying that yoga is not only asana. We have to actually talk about Ashtanga yoga, and we have to incorporate this mind medicine. We are just looking at the body up till now, but now we have to have this mind concept at all levels of all physicians, endocrinologists, and all the metabolic treating physicians, which should be scientifically taught to all of us. And for the same thing, if bodies like Endocrinology Society is accepting this, it can be taken to all the levels. And to talk about this, now we have Dr. Sahai, who will be talking about this. So Dr. Rakesh Kumar Sahai, he is a professor and head of the Department of Endocrinology, Osmania Medical College and Hospital, consultant endocrinologist, Sahai's Endocrine and Diabetes Center, Amirpet, Hyderabad. He is the president of Endocrine Society of India and vice president, South Asian Federation of Endocrine Societies, section editor, Tropical Endocrinology, Endotext, online textbook of endocrinology, editorial board member of IJEM. He is awarded with many fellowship of National Academy of Medical Sciences 2021, Fellowship of American College of Endocrinology 2009, Fellowship of RSSDI 2015, Fellowship of the Indian College of Physicians in 2006, Fellowship of Indian Academy of Clinical Medicine 2008, and he has many publications, over 150 publications in various national and international journals, and he has authored chapters in various textbooks. So we will listen to his address today. Over to Dr. Rakesh.
Yeah, good morning to all of you. Thank you for the kind words of introduction, and thanks to Dr. Vaishali for inviting me to be here. And I would like to congratulate her and the entire sphere for conducting this very important meeting, which is the third in its series. I was privileged to be part of the earlier two meetings also, and today I'll be speaking about the role of yoga as a therapeutic tool for mind-body medicine. So thank you once again, and it's a pleasure to be here. And I see that we have a huge, very good audience for the last 2 days, so I think this is shaping up to be a very important meeting, and I'm sure there has been a lot of discussion about yoga with Dr. Indranil also being part of this, and also I was hearing the earlier presentations where there was a little discussion on cardiac autonomic neuropathy, the role of yoga, and all other ways of altering that, modifying that. So what I'll do today is that I will in my presentation I will speak about how yoga has an important role, has found a place in ancient Indian medicine, and discuss about the earliest scientific work on yoga dating back about 40 years earlier, and then discuss about recent data of last two decades, a meta-analysis of all this data. Quickly, I'll just summarize some of the aspects about yoga, and then probably mention a little about the pathophysiological mechanisms which can explain the benefits of yoga in the management of diabetes particularly, and also it has a specific role in various other lifestyle disorders. And with that, I'll summarize. So if you look back at yoga, I mean, it's been part of our tradition. It dates back more than 5,000 years, and if you look at the antiquity of modern traditional medicine, it goes back to over 5,000 years, as evidence in the Atharva Veda, which was the science of life. And as Charak had said, swastasya swastha rakshanam aturasya vyadhi parimokshanam, which means that the aim of traditional medicine, according to Charak, is to maintain the health of the healthy person and relieve the suffering person of his sufferings. So that's how ancient medicine looked at not only treating the medical problems, but also promoting health. And apart from its spiritual philosophy, yoga has been utilized as a therapeutic tool to achieve positive health and control and cure diseases. This concept is promoted in Hatha Yoga and Gatasya Yoga. So, as we have seen, yoga originated in medicine more than 5,000 years ago. Yoga is a means of balancing and harmonizing the body, mind, and emotions. Yoga practice is useful in the management of various lifestyle disorders, including type 2 diabetes. Psycho, neuro, endocrine, and immune mechanisms are involved in the beneficial effects of yoga on diabetes. Incorporation of yogic practice in daily life helps to attain the glycemic control and reduce the risk of complications in people with diabetes. So yogic practices, if you look at they consist of a physical component, which may be in the form of postures or asanas, and a relaxation component, which is in the form of meditation, which is exemplified by Shavasana. With its focus on controlling breath, holding postures, and meditation, yoga increases the practitioner's attention to bodily sensations and present moment experiences, thus contributing to yoga as a mindfulness-based activity. Mindfulness may help improve diabetes management by increasing individuals' ability to recognize emotional stress and to respond with more effective coping strategies. So, I will discuss some of the earliest works. These are studies done by my father, Professor B.K. Sahai, who's a patron of RSSDI and been past president of RSSDI and API. He conducted these studies in almost 4 decades ago. In the period from 1978 to 1995 at the Vimana Yoga Research Institute in Secunderabad. So during their studies, I mean, I've borrowed the slides from him. So during the study, they have extensively carried out well-designed studies to assess the effect of yogic practices in the treatment of diabetes, hypertension, obesity, and asthma. So I'll quickly review some of these the data from these studies. So they designed their studies basically to address 2 questions. Does yoga play a role in control of diabetes, and if it does, what is the mechanism of action? To do this, because this was a time when there was probably not much of scientific data available on yoga, and this was one of the first few studies that they had conducted, and they conducted studies on normal volunteers, athletes, growing children. They followed them up for 3 years. They looked at hypertensives, they looked at diabetic patients, type 1 and type 2 diabetic patients, and also diabetics with hypertension, with comorbidities like hypertension. So these were all the subjects which they enrolled in their studies to study the effect of yoga on various aspects. And these were some of the publications they had in various journals around that time. In the late 80s and early 90s, they had these publications. And what they have identified from their studies is the beneficial effect of various yogic practices For treatment of diabetes, they have looked at the effects of pranayama, Shavasana, Dhanurasana, Ardhamatsendra Asana, Paschimotsaasana, Halasana, Bhujangasana, Nokasana, and Vajrasana. And their sessions were typically carried out over 45-minute sessions. They have carried out for advice for those who were the subjects who were practicing yoga, and then they carried out various studies, and they found beneficial effects on. I'm not going into details of each of these papers, but a broad summary of all the studies that they have published. They looked at they've showed the beneficial effects on hyperglycemia, hyperlipidemia, hypertension, hyperinsulinemia, and also in terms of elimination of stress. They looked at the cortisol levels and found lowering of cortisol levels. So they had even followed up 32 of their subjects. They had followed up for 10 years and shown that they had not developed any long-term complications. Although they did not have a control group, but the small number of patients that they could follow up, they found that they were free from complications. So what they had shown in their studies was that there was a reduction in the body fat percentage, the increase in lean body mass, and upregulation of the insulin receptors. So which made them postulate that there is a decrease in insulin resistance, and also upregulation of insulin receptors and insulin sensitivity improvement. And based on these parameters that they had noted, they had studied, they had postulated that yoga may have a role in preventing type 2 diabetes. The reasons why they suggested this was because reduction in body fat percentage was shown with increase in lean body mass. There was upregulation of insulin receptors, normalization of the insulin glucose ratios, and elimination of stress and a decrease in output of counter-regulatory hormones. Based on these, they had suggested that yogic practices improve insulin sensitivity and reduce insulin resistance, which is the major abnormality preceding the development of diabetes by several years. And they therefore postulated that there could be a prevention of beta cell exhaustion and prevention of NID in type 2 diabetes in patients who were practicing yoga. So they had also designed a preventive study, which they had a small number of patients where they could show that as compared to the control group, the group that was practicing yoga were free from diabetes. The individuals pre-diabetes, they had stratified individuals with pre-diabetes to the yogic practices, and had a control group which was going with other normal exercises, with usual exercise, usual physical activity and routine standard of care. And they showed in that small group of 30 odd individuals in each group, they showed that there was a prevention of diabetes over a 4-year follow-up. So based on these studies, I think there have been a lot of other studies which have been conducted in the recent past, and we have in the last 2 decades we have a lot of work being done across the globe, not only in India but across the globe. And Dr. Indranil is coming out with a beautiful book on which summarizes all these studies. So, but basically, I would try to quickly give a bird's eye view to that, and we have seen that yoga is an important tool for mind-body medicine modulation, and traditionally we say that it's a mind-body practice with the ultimate goal of spiritual enlightenment. Yoga is a science of health management rather than a therapy for specific diseases. Yogic practices are complex interventions with various components. You have a cleansing process, you have various asanas, you have the breathing exercises in the form of pranayama, meditation, relaxation and chanting of mantras, and yogic diet, code of conduct and philosophy and spirituality all add to this benefit that is seen with yoga. One of the important aspects that we have been seeing with management of diabetes is that we understand that lifestyle measures, lifestyle modifications like dietary changes and exercise have a very important role in management of diabetes. The role of that is very well understood. But what we find is that with the changing lifestyle, it is becoming more and more difficult for individuals to have adherence to this guidance, the guidelines, I mean lifestyle advice that is given to them. And several studies have shown that there is poor adherence to diet and exercise programs, and these are the major limitations which have been towards implementation of these non-pharmacological treatments for diabetes. Although we have a lot of evidence from trials of diabetes prevention like the Finnish study, the DPP study, all these studies have shown that lifestyle changes have a very important role. So I think here yoga pitches in because it introduces a component of not just physical activity, but it also has something beyond that, and that's the reason why it probably adds and provides the benefit of giving people the importance of mindful eating, and also improving the physical activities. Meditation and ability to heighten mindfulness may be beneficial in controlling the binge eating patterns. Mindful eating in diabetes has been shown to facilitate improvements in dietary intake, modest weight loss, and glycemic control. So if we look at the recent meta-analysis of 23 studies which had more than 2,473 participants with a mean age of 53 years and about equal number of women and men, what we see is that yoga brought about improvement in the HbA1c levels, improvement in the fasting glucose and postprandial glucose levels, and there was significant improvement in lipid profiles, blood pressure, body mass index, waist hip ratio, and cortisol levels. So a forest plot of this shows the effect on HbA1c. You can see clearly there is a benefit in terms of favoring the intervention of yogic intervention, and you can see similar benefits with on the fasting glucose and the postprandial glucose levels. And what you can see in this meta-analysis was that there was a benefit not only in the glucose parameters, glycemic parameters, but also improvements in the lipid parameters. As you can see, all the lipid parameters did improve. Blood pressure, particularly the diastolic blood pressure, the body mass index, all these parameters, and the fasting cortisol level also were improved in all these studies. A meta-analysis of all these 23 studies has shown the benefit. Other meta-analyses like the one published by my good friends here who have looked at 751 subjects across 9 studies, they showed that there was a improvement in the glycemic parameters, namely the fasting and postprandial glucose levels, but they did not see a significant improvement in the HbA1c levels. But they did see the additional benefits on the lipid parameters, the total cholesterol, the LDL cholesterol, and the triglycerides. So clearly what we see is that yoga is beneficial in the management of diabetes, works well and provides additional metabolic benefits in comparison to individuals undergoing active exercise protocols, as well as in those undergoing standard diabetes management with regard to improvement in some of the glycemic and lipid parameters. It certainly has a very important role to play in the management of diabetes. Now, there's a very interesting study from South India, which was from the Apollo group, Apollo Total Health Program, which was carried out in the district of Chittoor, where they retrospectively looked at their records of and identified 146 patients who were practicing yoga and compared them with another similar number of people who were practicing other standard protocols of exercise and dietary guidelines which are given as standard of care. And what they did a propensity score matching of these individuals, and they tried to look at the composite outcome of ADA defined composite outcome of A1C less than 7, blood pressure less than 140/90, and lipid levels of less than 100 LDL cholesterol. And they looked at these two groups of individuals, that is those who are practicing yoga versus those who are practicing other giving standard advice on diet and exercise. So compared to standard of care, adjunct yoga treatment was found to be significantly facilitate the attainment of this composite ADA score of by 8-fold. So there was 8 times higher achievement of this composite score in people who are practicing yoga as compared to those who are on a standard therapy, that is of routine advice on lifestyle advice. So clearly this shows that yoga has a beneficial effect, and this data goes on to show that. So what could be the mechanisms of benefit of yogic practices in patients with type 2 diabetes? There are probably 2 or 3 different levels of changes that we are seeing. We have changes in the physiological levels, we have behavioral changes. The important benefit is that there are behavioral changes also produced, and if you look at the psychological changes and the physiological changes. So if you look at the physiological changes, you can categorize them as the effects on body weight, BP, heart, lipid profile, which you've seen in this. In addition, there are effects on immunomodulation, which is changing the gene expression, cellular immunity, inflammatory response. This is I think something which is very important in terms of promoting good health. And the sympathoadrenal and HPA axis also is affected, and this is evidenced by changes in various hormones like increase in melatonin, endorphins, and decrease in growth hormone prolactin, cortisol, and adrenaline. Increase in insulin secretion, decrease in insulin resistance, and improvement in cardiac autonomic functions, coagulation profile, nerve conduction studies, and also improvement in cognition. Apart from the psychological benefits, that is improvement in the quality of life and particularly elimination of stress. So all these mechanisms probably explain some of the benefits. As we know, stress is a root cause of many diseases, and through constant deregulation of the HPA axis and the sympathetic nervous system, stress keeps the entire mechanism in chaos, and dysregulation of hormones such as cortisol and catecholamines. Their increased stimulation over a period of time causes diseases such as type 2 diabetes. Yoga acts in opposite manner by bringing balance to both the autonomic nervous system and the HPA axis. It reduces the secretion of cortisol, catecholamines, inflammatory cytokines, renin, and anti-inflammatory factors are promoted. So there is also an effect on the EEG patterns also. As you can see, there was a preponderance of alpha waves in yogis who were practicing yoga as compared to those who are not practicing yoga. So as you can see that there is a elimination of stress, which is particularly working through the effects on the HPA axis and the endocrine functions, and a positive effect on the immune system, and also therefore reducing the stress related psychosomatic disorders. So yogic interventions work at these different levels. I mean, if you look at the effect on the autonomic nervous system itself, you can see that there is an effect on the sympathetic system, reducing the sympathoadrenal activity, and thereby improving the oxidative stress and improving the endothelial functions, and simultaneous effect on the parasympathetic activation, leading to reduction in inflammatory cytokines, reduce heart rate and blood pressure, enhance metabolic and psychological profiles, increase insulin sensitivity, increase glucose tolerance, and improvement in lipid profile, and improvement in anxiety, mood, and depression. So we can see the interactions are very complex, and so I think yoga seems to be very promising in its anti-stress mechanisms and positive modulation of the HPA axis. There are studies which have looked at the effects on cardiac autonomic system and have shown the benefits, as you can see in this study. And this is a study which was done. Interesting part is that this was a study done in non-diabetics. They are the non-diabetic offsprings of diabetic parents, and there again they found that improvement in the autonomic functions, improvement in insulin resistance, and these parameters, suggesting that yoga can reduce the risk of development of diabetes in offsprings of diabetic parents. The major problem is probably adherence to yoga. So this was a community-based study which was looking at how much of adherence can be seen. So this was a study done in Bangalore, and what they found is over a 6-month period, when they looked at the adherence to yogic practices in people who had initiated yoga, they found that the adherence was again about 50% only. So I think this is the major challenge that we see. Improving adherence has to be the major challenge that we have to focus on, and we all know that there are benefits which are clearly seen in all these studies. Strategies to motivate participants with type 2 diabetes to undergo lifestyle modification practices, including the adherence to yoga, is going to have far-reaching beneficial effects in not only managing their diabetes well, preventing complications, and having a overall benefit on their health. So finally, I would like to conclude by saying that yoga has been a part of traditional Indian medicine, and it has been shown to have several therapeutic benefits. Recent studies have also highlighted the benefits of yoga in the treatment of lifestyle disorders and cardiometabolic disorders like diabetes. It's a perfect model for mind-body medicine, and the current challenge is basically to educate people on the benefits of yoga and ensure compliance to this traditional practice, which has far-reaching benefits. So I thank you all for the attention, for the kind, and thank Dr. Vaishali for giving me this opportunity to be here amongst this audience, august audience, and wish her all the best in her future endeavors.
What we have to do is we have to tell our patients not only for yoga as a exercise, but mindful yoga. And we must realize that this is the only way which will help us in primordial, primary and secondary prevention of all the NCDs. And regarding adherence, when we talk about the drug adherence or treatment adherence, we should be talking at every visit about yoga also, whether they are still doing yoga. So we should be more into that. Especially for giving me this opportunity, and I take this opportunity to promise that me, along with my colleagues, all the physicians in Navi Mumbai and endocrinologists and psychiatrists, we are ready to take this torch ahead of Synapse, and definitely under your able guidance, Chetan, Vaishali and Dr. Phadke. Thank you so much. Actually, I should say MBM should be one of the thing which should be taught to our, and you will be surprised, my parent institute, Jayashree, is also from the same institute. Still now we don't have any psychiatrist seat in GMC Nagpur. So many years. At our time also it was not there, and now also it is not there. In Maharashtra, there are very few seats in government medical colleges for psychiatry also. So we are lacking on that. Yes. So it should be taught very scientifically in all the medical field. Thank you. Thank you so much.
So with this, we close the session. I thank Dr. Kirti Samudra for moderating this session excellently.